Steph, let me go from the medical, and you can weigh in on that if you want, but to the political. I first of all, want to just say to everyone, Health Canada is not political. They are following the data. This is critical for people to know. They're not doing this to give Justin Trudeau a win or to beat the Americans. And Dr. Sharma was clear about that. Nonetheless, Steph, there are political consequences. What does this do to the criticism of Justin Trudeau was Canada's at the back of the line that the opposition was has been hammering at him for months?
So the opposition has had a problem since the outset of this pandemic. And the problem has been that there's a very fine line to walk when it comes between doing your job, which is holding the government to account, and inflaming public fears and casting doubt about the government response, which includes the response of folks like the scientists at Health Canada. So the go forward for the opposition now is to find an even better way to walk that line. Because as you point out, Health Canada is not political. Health Canada is nonpartisan. Health Canada took their time, did their due diligence, and the Conservatives, I would say in particular, have to be very, very careful here because, you know, the more they challenge, the more they push the government, the more there exists the risk that they're going to sow confusion and doubt about the vaccine itself. And above all, there should be a nonpartisan approach to communicating the very essential public health messaging around not just the vaccine, but the fact that the vaccine is not an immediate panacea, that the social distancing can't stop, the mask wearing can't stop, the hand washing can't stop. But it's going to be a very, very, very long time that we get to COVID zero in this country and around the world. And if they're not careful and they inflame those tensions, that's going to blow back badly on them.
Yeah, Rob, let's keep focusing. There's huge logistical challenges, both from a health side, from a distribution side. The baton will be handed off to the provinces on that, but they also then have a political challenge. What is this accelerated good news? Like, let's not squash this. The good news of the accelerated timeline of the arrival of the vaccine and the approval, Benz, what are the political implications on a provincial side?
Well, for premiers like Doug Ford here in Ontario, Evan, there's now the pressure will be on him to deliver the vaccine. Once Justin Trudeau gets the vaccine on Canadian soil, then it's up to the premiers to get it to their various provinces. And here in Ontario, General Rick Hillier, the former chief of the defense staff, is leading Ontario's efforts. So there are a lot of logistical balls in the air and a lot of people working hard on that here at Queen's Park. Now, one of the things, though, that is going to be a challenge that we've noticed, we have a poll in the Star today that showed there's 92% awareness of vaccines, of the two vaccines, but there's only 55% acceptance that they would take the vaccine of the 1,000 people we polled. The campaign research polled for the Star. So I would be concerned if I were a government official at that skepticism that the doctor and that Steph were talking about. Like, there is that problem that, yeah, there's going to be a lot of news coverage about adverse reactions and allergic reactions and so on, and that's going to be magnified. It'll be maybe magnified by the media and by opposition parties. So they have to be very, very careful. And governments of all stripes across the country have to get the information to Canadians and let them know whether this vaccine is safe. Presumably it is safe since Health Canada has approved it.